everyone, welcome to question paper discussion on orthodontics and dentofacial orthopedics part 4. I am Dr. Purnashri. Today we will be discussing the topics biology of tooth movement, mechanism of tooth movement, anchorage, interceptive orthodontics, methods of gaining space and arch expansion. So let's start with biology of tooth movement. Here we have a long essay. Enumerate various theories of orthodontic tooth movement. Explain piezoelectric theory of tooth movement. Explain the histological tissue response to light forces. So we'll start the answer by defining what is orthodontic tooth movement. So orthodontic tooth movement is the result of a biologic response to interference in physiological equilibrium. So when the physiological equilibrium there is some interference, there is a biological response, and this interference is caused by an externally applied force. So these three terms are important in the definition. Then we write about the various theories of orthodontic tooth movement, that is pressure tension theory by Schwartz, fluid dynamic theory by Bean, and the bone bending theory by Baumrind. This bone bending theory was initially given by Farrar, but later Baumrind popularized it and proved it. So this bone bending theory is also called as the piezoelectric theory. So we have to explain that in the second part of the question. So you can explain that you can also write this flowchart here. So when the alveolar bone bends, there is deformation of crystalline structures. So due to the deformation, there is a formation of an electric signal which causes change in the bone metabolism. Bone metabolism changes the cellular differentiation, which causes the tooth movement. You can also add in this diagram. So the positive charges this side, when the bone bends this way, the positive charges represent the bone resorption, and wherever there is a negative charge, there is bone deposition. So this is what is the piezoelectric theory. Then coming to the third part of the question, asking us to explain histologic response to light force. Light force meaning mild forces. So you can add this diagram here. This is how the tooth anatomy it looks normally, and when a mild force is applied, this is how it appears. So the plus symbols is the bone deposition. This is the tension side where there is stretch, and minus shows the bone resorption. This is the pressure side, this side. So you can explain the steps that are occurring on the pressure and the tension side when a mild force is applied. Moving to the next question, that is a short essay, optimum orthodontic force and hyalinization during orthodontic tooth movement. So first we'll define what is the optimal orthodontic force. So according to Profit, he says optimal orthodontic force is a force that is high enough to stimulate cellular activity without completely occluding the blood vessels. Okay, Schwartz also says something similar, that is the optimal orthodontic force is approximated the capillary blood vessel blood pressure, that is 20 to 26 gram per centimeter square. So this is the value that is important for you to remember. It can be asked in vivas also. Then what is hyalinization during tooth movement? So when a heavy force is applied to the periodontium, what happens is the blood supply to the PDL is occluded. When there is no blood supply, there is a necrosis, aseptic necrosis. That means there is no bacterial or any microorganisms present in that necrosis. Then the PDL becomes hyalinized. So this is called as the hyalinization. And when the hyalinization occurs, the type of resorption that takes place is called as the undermining resorption. So basically you have to explain this procedure in detail. Moving to the next question, piezoelectricity. This is a short note. So piezoelectricity is observed in many crystalline substances when they are deformed. So when a substance is deformed, there is a current is produced as the electrons are displaced from one part of the crystal lattice to another. Okay, similarly in collagen and bone also have a crystalline structure, and so they also exhibit this piezoelectricity in the pedial and alveolar bone. So that is what is the piezoelectricity importance in orthodontics. And the characteristics of piezoelectricity are there is a quick decay, and there is a production of equivalent signal in opposite direction when force is released. Other short notes asked in this are tissue changes on pressure side. So you have to explain the changes that are occurring when force is mild, force is applied, and when an extreme force is applied. You can draw the diagram I had shown previously. And then hyalinization. Hyalinization also I had discussed in the previous answer. Another question is phases of tooth movement. This is again a short note. So there are three phases: initial phase, the lag phase, and the post lag phase. So this is the graph that you have to draw along with this, and then explain what are the changes, how the tooth movement occurs during these three phases. Next topic is mechanism of tooth movement. Here we have a long essay, enumerate various types of orthodontic tooth movement. So this list of types of tooth movement you have to remember. This has been asked multiple times as a part of many questions and also as a short note. Then mention the difference between controlled and uncontrolled tipping. Explain the tissue response to heavy forces. So the various types of tooth movements, basically there are three types: translation, that is bodily movement, pure rotation, and a combined rotation and translation. These are the three basic types. Again, based on these can be divided under these 6 types, where there is tipping, which means there is a combination of rotation and translation. Then there is pure translation, rotation, intrusion, extrusion, uprighting, and torquing. You can draw these diagrams here showing how the tooth moves during these movements. This you can draw the center of rotation and resistance also in the diagrams. Then we explain about the types of tipping, that is controlled tipping and uncontrolled tipping. So in controlled tipping, the root remains in the same position more or less, and the crown moves. Okay, so the center of rotation is at the apex here. In uncontrolled tipping, both the crown portion and the root portion move. So the center of rotation is somewhat closer to the center of resistance. Then we come to the third part of the question. Explain the tissue response to heavy forces. So I have discussed this in brief in one of the previous answers. You can explain in form of this flow chart also. So when a heavy force is applied, when a heavy orthodontic force is applied, this causes compression of the blood capillaries. So when there is compression, there is ischemia. Okay, when there is ischemia, what happens to the periodontal ligament fibers? They start to shrink gradually. And then the cells become indistinct and the nucleus becomes pycnotic. So there is cell damage, cell death. So the compression of collagen fibers, all these compressed fibers, they unite to form a cell-free mass. And there is some changes in the ground substance also. So this cell mass, where there is cell-free mass, is called as the hyalinized zone. You can also call this as a aseptic necrosis. So these are the changes. Coming to the short essay, we have enumerate the different type of orthodontic tooth movement. This we have discussed now. Then explain center of resistance and the center of rotation in orthodontic biomechanics. So these terms are very important for you to understand any type of tooth movement in orthodontics. Okay, so let's start first with center of gravity, or it's also called as the center of mass. So every object or a free body, there is one point where all the weight is concentrated. So the point where all the weight appears to be concentrated is called as the center of mass or the center of gravity of that object. But center of resistance, so unlike in free body, the movement of tooth is constrained. That is, the tooth has periodontal ligament and it is surrounded by bone. So it is not a free body. So the center of gravity in a restricted body is called as the center of resistance. And what is center of rotation? So when a body moves from one point to another, where the two axes, the two positions, initial and the final position appear to meet, or where the body appears to rotate, is called as the center of rotation. So in different types of tooth movement, the center of rotation is different. So in translation, it lies at infinity because the two lines are parallel, the initial and the final position lines. And in uncontrolled tipping, it is slightly apical to the center of resistance. In controlled tipping, it is at the apex of the root, and for root movement or torquing, it is at the incisor or the occlusal edge. So here you can see this, the center of the green dot is the center of resistance and the orange dot is the center of rotation. So let's think this is this line here, this is the long axis of the initial position, and this is the new position, the dotted line. So where they both appear to meet is the center of rotation. The short notes we have here is tipping tooth movement, tipping, optimum orthodontic force. So these three we have discussed already. So tipping, we've got it as a part of the long question also, and also in the short notes. Then we have types of orthodontic force as a short note. According to Profit, he has classified orthodontic force as continuous, interrupted and intermittent. So continuous force is when the force is maintained at some appreciable fraction of original from one patient visit to the next. Then there is interrupted, where the force levels decline to zero between the appointments. And there is intermittent. Intermittent force is when there is the forces abruptly decline to zero. So example, when patient is wearing a headgear. So when the patient is wearing a headgear, there is force. The moment he removes it, it suddenly decreases to zero. So that is intermittent, abruptly decreasing to zero. That is type of intermittent force. So you can also draw these diagrams here. There is force and the x-axis is the time. So this first graph shows the continuous force. This is the interrupted force when the force is gradually decreasing over time. And then there is intermittent force where the force decreases to zero suddenly between the wears, and also gradually it is decreasing over time. Then according to Schwartz, he has divided into 4 degrees: first, second, third and fourth degree. So the first degree of efficiency, he says the force is below the threshold to stimulate a tooth movement, and it is also of short duration. Example is the Frankel's appliance. Then second degree of force is the most favorable for continuous tooth movement without root resorption. So this force is less than the force that is required to block the capillary vessels. This is around 15 to 20 grams per centimeter square. Then we have third degree efficiency, that is to this force is sufficient to interrupt the blood circulation of the PDL. This is a medium strength and this is 20 to 50 grams per centimeter square. Then there is fourth degree of efficiency where the force is too much and it crushes the PDL, and it is responsible for damage to the affected tissues and causes necrosis. So these are the types of orthodontic force. According to Profit, we have continuous, intermittent and interrupted, and then according to Schwartz, we have these 4 degrees. Then we have a question, couple and its role in orthodontic tooth movement. So couple occurs when there are two forces equal in magnitude but they are opposite in direction. There are the red arrows here, you can see, right? So that is the force. This causes the tooth to rotate. So there is no translation and produces a pure rotation around the center of resistance. So from clinical point of view, that is its role in orthodontic tooth movement, we can apply couple only on the exposed part of the tooth. Depending on the plane in which the couple is acting, the moment has been called rotation, that is first order, this way. Then there is tipping, and the third order is called the torque. The next topic for today is anchorage. So the long essay is define anchorage. So according to Graeber, anchorage is defined as the nature and degree of resistance to displacement offered by an anatomic unit when used for the purpose of tooth movement. So this definition is important for you to remember. Then the second part is classify different types of anchorage and describe the various types with suitable examples. So there are different classifications given by different authors. I've listed out 5 classifications. You can remember these and then you can write the appropriate examples for these also. So the classification by Moyers, that is simple, stationary and reciprocal. This is important for you to remember because this has been asked as a separate question also. The next question is very similar to the one we discussed previously. Define anchorage, then give Moyer's classification. So Moyer's classification is the one simple, stationary and reciprocal anchorage. Then explain the different types of anchorage with suitable examples. So you have to give examples for these. Next question again is define anchorage. Then list the various types of anchorage that also we have discussed, and then describe in detail about various factors to be considered for selecting a tooth as a source of anchorage. So the factors that we consider in a tooth to be considered as anchorage, there are 7 points here. That is the root form. So the root form can be round, flat or triangular. The triangular type of root form gives us most anchorage, whereas the round gives us the least anchorage. Then there is root length. The longer the root, more the anchorage, because there is more surface area when the root length is increased. Example is the maxillary canine. Then the number of roots. More the number of roots, more anchorage. Then size of tooth, same way. Larger the tooth, larger the anchorage. Number of teeth, more anchorage. Inclination of the tooth. So that means if the tooth is inclined in the direction opposite to the tooth movement required, it gives us better anchorage. And then an ankylosed tooth acts as an excellent anchorage unit. So these are the factors to be considered for a tooth to be considered as a source of anchorage. The short essays are extraoral sources of anchorage. So extraoral sources of anchorage are the source anchorage that we obtain from units outside the oral cavity. So you can write down about the uses of extraoral anchorage, that is where do you use extraoral anchorage, and then about the types, that is cervical, occipital, cranial and facial. So these are the examples. You can explain about the examples also. Then the next topic is interceptive orthodontics. The short essay here is define serial extractions, mention the indications, advantages and methods of serial extraction. And then another question is serial extractions also. So the answer, first we'll start by defining what is serial extraction. Serial extraction is defined as a planned and sequential extraction of certain deciduous or permanent teeth in a specific order to encourage spontaneous correction of irregularities. So the two main terms that you have to remember is planned and sequential extraction to encourage the spontaneous correction of irregularities. Okay. Then coming to the indications. Indication is when there is a class 1 malocclusion with a tooth size arch length discrepancy of 5 mm or more per quadrant. Then class 1 bimaxillary protrusion when there is a mesial terminal step in mixed dentition, and then class 2 cases when there is maxillary dentoalveolar protrusion and the mandible is normal. So in these cases we extract only in the upper arch. Then the advantages of serial extraction. When we do serial extraction, it is more physiological. It reduces the duration and the cost of the orthodontic treatment later, and it maintains the health of the gingival and the investing tissues. It's more stable result. Less retention period is required because the teeth are directly erupting into their positions that they're supposed to be, and the oral hygiene maintenance is better. Then the methods, we have the dual, Nance and the Tweed method. So you have to explain about these, the sequence of extractions in each of the methods. And if the question is just about serial extraction, you can write about the contraindications and the disadvantages of it also. The next question is, list the various procedures undertaken in interceptive orthodontics. Describe in detail about serial extraction. So the serial extraction part we have discussed already. Coming to the procedures in interceptive orthodontics. So first we'll define what is interceptive orthodontics. So the elimination of existing interference with the key factors involved in development of dentition. So this is the interceptive orthodontics. So the procedures are serial extraction, closure of diastema, space regaining, expansion, control of abnormal oral habits, crossbite correction, myotherapeutic exercises, and interception of developing skeletal malrelations. Coming to our next topic, methods of gaining space. Enumerate different methods of gaining space. Explain the role of expansion as a method of gaining space. So we have various methods of gaining space. It can be proximal stripping, arch expansion, extraction, distalization of molar, uprighting of tilted molar, derotation of posterior teeth. So when we derotate posterior teeth, we gain space, and when we derotate anterior teeth, we need space. So this is one thing that you have to remember. Then there is proclination or flaring of anterior. These are the different methods. So expansion is one of the method to gain space, which is non-invasive, and it is mainly done in patients with a narrow arch. Then you have to write about the indications for expansion, and then you have to explain about the types of expansion. There is rapid expansion and slow arch expansion. So under rapid, what are the types of appliances that are available to us, and under slow, what are the types of appliances available to us. This is what you have to explain under expansion. Next question is, enumerate various methods of gaining space, which you have discussed. Then there is explain therapeutic extractions. Add a note on molar distalization. So the first part we have discussed. Extraction, you have to write about the indications for extraction. That is, why do we need to do extraction, when do we do extraction. Then according to Carey's analysis and the Ashley-Hose analysis, what are the indications to do extraction, you have to write. Then coming to the third part of question, distalization of molar. So you write what is distalization. So these are the procedures aimed at moving the molars in distal direction so as to gain space. Then you write about the indications for distalization. When do we do distalization? What are the types of patients in which we do distalization? Then the methods. There is extraoral approach, the intraoral approach, and the examples. That is the appliances used for it. Extraoral, for example, the headgears. Intraoral, you can write about the pendulum appliance and the other various appliances that are available. Then what are the indications for space gaining in orthodontics? That means, why do we have to gain space in orthodontics? Then mention the various methods of gaining space. Explain the role of extraction. So indications for gaining space gaining are so in some malocclusion and in those cases where tooth material and arch length discrepancy is present, space is needed to correct these malocclusion. So some situations where we need to gain space are crowding, anterior proclination, that is bimaxillary protrusion or proclination of anteriors, then impacted canine, when there is no space to bring the canine into the arch, curve of spee leveling, that is when there is a deep curve of spee, and if the arch is constricted. Then the various methods of gaining space and the role of extractions we have already discussed. The next question is, enumerate the various methods of gaining space. Describe the role of extraction as a method of gaining with reference to different anchorage situation. So here again you have to read the question carefully. It is not just the role of extraction, but in reference to different anchorage situations. So you have to tell in different extraction patterns there are different anchorage considerations. So when we extract a first premolar, they leave behind the posterior segment that offer adequate anchorage for the retraction of anterior segment. So when we extract first premolar, there is second premolar, first molar, second molar that can act as an anchorage unit. Same way, when we extract a second premolar, this alters the anchorage balance in a way that favors closure from behind. So there are less units or number of teeth in the posterior segment, so the posterior teeth tend to move. So this type of extraction can be done in borderline extraction cases. Then there is Wilkinson extraction, that is extraction of first molars. Removal of these teeth will deprive the anchorage need. So we are removing the main tooth that is used for anchorage, the molar. So we can use this when there is minimum need of anchorage. The short essay is enumerate methods of space gaining and explain proximal slicing. Methods we already know. Coming to proximal slicing, it is a method in which proximal surface of teeth are sliced to reduce the mesodistal width of the teeth. It is also called as reproximation, slenderization or disking. Then you write about the indications, contraindications, advantages and disadvantages of proximal stripping, and the instruments. You can add a note on the instruments that are used and the procedure for it. The short notes, uprighting of molars. So premature loss of, when there is a premature loss of the deciduous second molar, or when the second premolar is extracted, the first molar tends to tip into that extraction space. So when we correct this tipped molar, we gain some space. So this is called as the uprighting of molars. This can be done using uprighting spring or a space regainer. Next question is indications and contraindications for rapid maxillary expansion, that is RME. These are the indications and the contraindications that you can write. Last topic for today is arch expansion. So enumerate various methods of expansion in orthodontics with examples of appliance used for each, and describe rapid maxillary expansion in detail. So this flowchart I had shown you previously also. So arch expansion can be rapid and slow. Then you write about, under rapid we have removable, fixed and the bonded. Under fixed appliances we have tooth bone RME and the tooth and tissue bone. Then the examples of tooth bone are Hyrax appliance and the Isaacson type of RME. Under tooth and tissue bone we have Dirichlet and Haas type. So you can explain in short about each of these appliances and the design of theirs. So you can write about the indications, contraindications of RME, screw used in RME, the jack screw schedule, and the effect of RME on maxilla and mandible. The short notes are quad helix. So quad helix is a slow maxillary expansion device. It was given by Ricketts and was basically a modification of the W arch. So the indications are when there is a crossbite in the upper arch, when there is mild expansion needed either in class 2 or class 3 cases, and it can also act as a habit breaker in thumb sucking and tongue thrusting cases, and also in the cleft lip and palate cases where there is need for expansion. You can draw this diagram and label the parts. Then the short note is list the various slow expansion devices. So I have made a list here. You can write these down: coffin spring, active plate, W arch, quad helix, Schwartz appliance, Y plate, mini expander, Nite palatal expander 1 and 2, then jet spring and spring loaded expander. So with that we finish today's discussion. So if you have any questions, doubts or suggestions, you are free to leave it in the comment section. Bye bye.